Okay, I think we will start. Good afternoon, everyone. My name is Anita Au, and I'm the program lead for SCAG's Environmental Justice Program, and I will be facilitating today's meeting. Thank you for joining us for the second Equity Working Group meeting. We hope that you're staying safe and healthy. At this time, I announced it already, but then if you haven't done so already, please type in your name, pronouns, and organization into the chat feature so we know who's in the room, as well as ensuring that this feature is functioning for you. Next slide, please. So now on the slide before you, we have a handful of meeting logistics items. This meeting is anticipated to take approximately 2 hours. All participant lines will be muted. At the end of each presentation, there will be a Q&A. And then if you have any questions during the presentation, feel free to type it in the chat box. We will log all questions and answer them during the appropriate Q&A. If you think of anything later, you can also reach out to our presenters directly. And all presentations will be posted on the SCAG website within the next week. So as staff at SCAG, I acknowledge that we are on the land of the Chumash, Tongva, and Kizh. As we acknowledge, we are on the original lands of the Chumash, Tongva, and Kizh peoples, and how deeply the field of urban planning with land. We offer this acknowledgement as a first step to more conversations and actions that will support Indigenous communities in thriving. So some additional resources for learning more are being put into the chat. So if you're interested, feel free to explore some of these links. Will be in the chat shortly. Slide. So for our agenda, after my brief welcome, we'll start off the meeting with presentations from on 2 great equity tools from Advance OC and the City of Los Angeles, followed by our Equity in Action presentation from the City of Long Beach. And we'll be closing off the meeting with an update on the Sustainable Communities Program Call 4 and a few other announcements. So without further ado, I would like to welcome Katie Calvoda from the Advance OC. During our first meeting back in June, the survey that we launched indicated that the group was interested in learning more about equity tools. So we just want to, we have 2 great equity tools that we're going to present on, and the first one is from Katie. So Katie, you have the floor.
Thank you so much. If people can give me a thumbs up that they can hear me, I'll go ahead and share my screen. Thank you so much. You never know with these things, you know. So I want to go through our PowerPoint presentation to show you some of the data that we collected. But then at the end, I'd also like to show you a live demo of the tool itself that's being hosted on our website, as well as a joint website with the Orange County Healthcare Agency. I also invited Hugh Nguyen, who's Director of Population Health and Equity for the Healthcare Agency in the County of Orange, to join us. And if he is here and will be joining, I'll ask him to say a few words about our collaboration towards the end of my time. So with that, hi everyone, I am Katie Calvoda and I'm with Advance OC. Our website is below for you to check out, so it is very easy to follow. I just wanted to talk about us as a nonprofit partner of the county. This is a public-private partnership. It was an initiative that we launched with the County of Orange. The Board of Supervisors approved this project and actually funded partial costs for the development of this tool. And they also helped us launch this into the community. But this is a public-private endeavor, and we are the private partner for this initiative here in Orange County. So our theory of change is really quite simple. You know, we asked the question, what would you do if you knew where suffering lives, where poverty persists and dreams are denied? What we know in our community is that time and time again, these places, these neighborhoods in our community that suffer often in silence, suffer through generations. So even though we generally know where they may be within Orange County, the specific dynamics and the diagnosis of the neighborhoods oftentimes are not conducted. And so this is our attempt at diagnosing equity by diagnosing neighborhoods. So just a little bit about us before we get started. This is the board of directors for Advance OC. We're an all volunteer board. I sit as chair for Advance OC, and then we have several other members of the community who've all sort of grown up here in Orange County and really wanted to give back in some meaningful way. And you can learn more about all of us again on our website. So the premise of this work is really a tale of two horizons. You know, Orange County has one of the most beautiful landscapes in California, but like very many other communities, we have systemic housing, health, educational, economic, and opportunity disparities. And our first question was, how do we close these gaps, right? So at Advance OC, we decided that we have to bring community stakeholders together to invest in equity-focused strategies. But before we can do all of that, we have to create this baseline, right? How is Orange County doing across various different metrics? And so we developed what's called a social progress index for Orange County. Using over 50 indicators, we can now measure, track, and map inequities in our community with neighborhood precision. And so I will show you a little bit about that. This is one of the screens from one of our dashboards on the Orange County Equity Map. And ultimately what we're talking about when we're talking about the intersection of health and equity is this notion that neighborhoods next to one another will have different life outcomes, life expectancy outcomes. So this is a map of the city of Anaheim, and you can see where Disneyland is located. So across the street from Disneyland, we have a neighborhood that has a life expectancy of 75 years. And then down the street from Disneyland, we have neighborhoods that have life expectancy of 89 years old. And so what we wanted to do was get to the root cause of why these disparities exist, right? So plainly in front of our eyes. So what we did was we partnered with SPI, Social Progress Imperative. They are well known nationwide for a global social progress index. They measure the United States compared to 163 other countries all around the world. And obviously, when you think about standardizing data for different countries, you can realize how much of a massive effort that is, right? To not only gather the data, but to standardize it and normalize it. But what they did in doing that was they set the gold standard for how to do this kind of work. And so we took this methodology and we brought it to Orange County. And we created the framework for what became the Social Progress Index for Orange County. And this is what it looks like. We have basically 3 dimensions. We have basic human needs, foundations of well-being, and opportunity. And I kind of view them as a pyramid with basic human needs at the bottom, foundations of well-being in the middle, and opportunity at the top. And you can see all of the various over 55 different indicators that we capture in this index. So everything from nutrition and basic medical care, right? You see their access to supermarkets. So we're talking about food deserts. We have folks, we're capturing water and sanitation. It talks about the Safe Drinking Water Act. We have housing. Who in Orange County has a housing cost burden for owners and renters? Where are our high eviction rate areas, et cetera? And then we have personal safety. So we actually collect crime data, personal crime, property crime, as well as motor vehicle accidents. And then we go into the second dimension, foundations of well-being, and we have things like preschool enrollment, right? This is access to basic education. It is not inclusive of everything we could have put in there, but it is, these are the driving factors for these categories. So we did what's called a principal component analysis, and we took all the various different data sets and the indices that exist, and we narrowed it down to the top driving factors within each of these components. And so we listed them for you here. In addition to doing the data work behind this, connected with CBOs and other county agencies in the first month of our work here. And we asked them, what is the data that you collect that's useful for you on a day-to-day basis, right? Carrying out your mission and your work. What is it that you look to see whether or not you've made impact or that you've achieved the outcomes that you've liked? So after the interviews, we were able to gather this collection of data sets to make it really, really localized and really meaningful for the people of Orange County. So then going on, you see access to information and communications, broadband access, cellular data subscription, households with no internet access. And then we go to environmental quality, which is time and time again, one of the hardest things to capture in terms of data sets. And then in opportunity, we also have things like voter registration, home ownership percentages, childcare deserts, walkability, all of the things that we over time have referred to sort of as components of health and well-being. But what we've done is we've sort of organized them all under one roof. So we have also, I want to point out something called inclusiveness. Where in Orange County do we have people living in linguistic isolation? Right? Where are they residentially segregated? So all of these things, again, are built into this Social Progress Index of Orange County. And when you see the aggregate score, the SPI score, this is what you're looking at. But in addition to that, we also map out every single one of these components and every single one of these indicators. So what that looks like is this. The US SPI score, as you can see on the top right-hand corner, is 85.7. So the County of Orange scores 44.5. So not as well as the country, the U.S., but definitely, well in some areas. As you can see by the bar graph, we do quite well in, measures of environmental quality, for example, higher in access to basic knowledge and personal safety, et cetera, but lower in other parts. So what you end up doing is we have then a ranking of all the cities in Orange County. So this is the Social Progress Index by city. We have a total of 34 cities in Orange County, and the highest ranking city is Aliso Viejo, followed by Mission Viejo, scoring at 55 points. And then at the bottom of the rank is Santa Ana and Stanton at 31 and 32 points. What we see here is a bifurcation really between two sections of Orange County. We have those that score higher than 50, and then those that score lower than 50. And because we're measuring every single census tract or every single neighborhood in Orange County, we actually have a score for every single neighborhood. So this is a list of the top 50 census tracts in Orange County. I wanted to remind you the average SPI score for Orange County is 44.5. So you can see here Laguna Niguel, that neighborhood is the highest scoring neighborhood in all of Orange County with a score of 65. And then we also have, of course, the bottom 50 census tracts. And what does this help us do is we can then now analyze these census tracts in these neighborhoods and say, what are the characteristics that are plaguing these communities, right? And vice versa, we can look at the top 50 census tracts and say, what are the characteristics that are sort of predicting that these communities are doing well in these areas, right? Are there trends that we can spot? Is there analysis that we can do to be able to learn from one another, but also to figure out what's working and maybe what's not working? So ultimately what this means is that because we have data down to the neighborhood level, we can then score them across all of these different metrics. So here you see the 3 dimensions: basic human needs, foundations of well-being and opportunity, and the various different components that make up those dimensions. And what we've done here is we've lined up every single census tract or every single neighborhood in Orange County on this line graph. And on the left-hand side, you see in the yellows and greens are the lowest performing neighborhoods along those categories. And then on the right-hand side, you see the highest performing neighborhoods along those categories as well. So what policymakers can do at the county level is look and see, where do we have the most disparity? And you can tell by the spread of these lines, right? If they're wider, that means there's more disparity. If they're tighter, that means there's less disparity. So at a glance, Orange County elected officials can look at this and see that we have an issue with public safety, right? There are communities that score really low with personal safety, and then communities that score really high. And alternatively, if you can look over here in the right-hand corner, you see that this is showing all cities, but you can actually go and select your own city. So the mayor of Costa Mesa can look at personal safety and say, why are we at the lowest, very lowest bottom of, of all the neighborhoods in Orange County? What is going on with this particular neighborhood, right? So to identify trends, large trends is in terms of where do we have the most disparity, but then it also allows you to go down to the granular level and really isolate those neighborhoods that really need additional investigation. And then one thing that I want to point out is when we did an analysis against median household income, what we find is that it's not a high predictor of social progress. So a lot of people might say, well, these communities have a lot of disposable income, so they can invest in things that will increase their score, or these communities are relatively, have low median household income, so that impacts their ability to spend and invest in different resources. And what we find here is that when you see the blue circles, the top blue circle is a community in Mission Viejo, San Juan Capistrano, and Laguna Niguel. And then the bottom blue circle is Santa Ana. And you can see that they have a relatively same median household income, but they achieve vastly different social progress, right, on the score. And then on the flip side, you have the two neighborhoods that I circled in red that have the same social progress index score, but vastly different median household income. So again, this median household income is not a predictor of whether or not we can achieve social progress. However, it does tell us, for example, a class of neighborhoods, which ones are doing well, overall, and which ones are not doing well, so we can figure out the trends in those categories. So this is what a scorecard looks like in our equity map. Anyone in Orange County can go onto our tool, type in their address, and a scorecard looks exactly like this will pull up, right? And so this is one of the highest scoring neighborhoods in Orange County. It happens to be in Laguna Hills, the city of Laguna Hills. But what you see here is a score out of 100, right? And then also a rank out of 580 census tracts. So this is the 4th highest ranking neighborhood in Orange County. So you see all the various different components that we talked about earlier, from housing to access to information and communications to inclusiveness. And you'll see these yellow dots and red dots and blue dots. And it's very simply tells us how they're doing compared to a peer group. So we created peer groups of every single neighborhood against 10 other neighborhoods that have very similar median household income to put them in sort of a relative context, right? So this particular neighborhood compared to its peers score low in housing. You can see because the red dot is right there. It's very easy to use reference point for folks who are looking to triage, specific neighborhoods. And then in things that they're doing well, this concept of the blue dots, you can see, personal safety is an area that they're doing well. And then conversely, this is a lower performing census tract, and this is a neighborhood in La Habra and Fullerton, and you'll see exactly the same transparency. And then on the right-hand side, we also provide demographic information to give some context, right, for this neighborhood. So we want to know what is the race and ethnicity breakdown, the age distribution, right, the population, and again, the median household income. So what I want to do now is give you a live demo of this, but before I do that, I just want to show you something that we've created with the healthcare agency. And this is a first of its kind COVID vulnerability map. So during COVID, what we knew was this is a new disease, right? We knew that we didn't know a lot about it, but what we did know is that this was a disease that impacted people that had underlying health conditions. It impacted folks that were older in age, as well as folks that had social vulnerabilities. So what we created was a composite index that included the health and comorbidity risk factors identified by the CDC, which were diabetes, cancer, high blood pressure, etc. We also mapped out in conjunction with that, folks that were 65 years and older in Orange County, right, as a factor. We also knew early on that that COVID was impacting our Hispanic and Latino community disproportionately as well. So we wanted to identify communities that had high Latino and Hispanic populations. And then we also then brought in these social vulnerabilities. So on the right-hand side here, you see our social progress index indicators and all the things that impacted the ability of somebody to be vulnerable to COVID, including housing overcrowding, including the population that was uninsured, people that had no internet access, etc. So we were able to put all of this together and created a COVID vulnerability map. And what we could do is then isolate by city. So every single city understood where their most vulnerable communities lived. And then we also overlaid infrastructure, community infrastructure. So we resource mapped where the senior centers were, where the community clinics were, where the churches, the Islamic centers, the Latinx grocery stores, in case we wanted to partner and do outreach into the community. We knew exactly who, what, where, when, why in every single census tract. And so that allowed us to, on demand, be able to react to the spread of COVID in Orange County. And then I just want to point out that obviously we are showing you one use case, which is for COVID, but there are so many other use cases that we could go into. For example, food and nutrition. So we have food insecurity maps that we could do. We could do community development with housing and homelessness, and then opportunity zones, etc., for economic recovery. So with that, I'll go ahead and show you what this tool looks like. Okay, so this is on our website. You have the equity mapping tool bucket here. You can go into our OC equity map, our social progress index, our COVID vulnerability index that I mentioned before. And so the map looks like this. So when we took in all of the social progress index scores, you see that it's all broken out by individual census tracts. And so you can actually pick any one of these census tracts and go and see a neighborhood scorecard, or you can pick by city. You can also pick by district. So we have 5 different supervisory districts in Orange County. You can see it by district as well. But what I wanted to show you is that we collected COVID data through our partnership with the healthcare agency, and we overlaid COVID cases on top of this map. And what you see here is a high positive correlation between our social progress index map and where we experience high COVID infection rates in Orange County. So that tells us one thing, which is social determinants of health was a major factor in COVID, where COVID lived, where COVID persisted, where we saw lots of COVID infection and also deaths. So what we have to do as a community from this is really triage the root causes of these social determinants of health. That is all of those things that were built into the framework of the Social Progress Index. It's housing, it's food access, it's transportation, it's crime, it's all of those things, being linguistically isolated or not. So this measure of inclusiveness as well, right? So in here, you can see all of the various different 55 indicators. You can pick any one of these and the map will repopulate to show you exactly where we have those vulnerabilities or not. We also embedded these CDC health indicators, and it'll show you, for example, where in Orange County we have asthma prevalence, for example, or where we have chronic kidney disease or smoking prevalence, right, in Orange County. So it helps hospitals and doctors and such determine, what factors may be relevant to a patient's treatment plan. So on top of that, what we have here is a manual for people to go and take a look at. But we also did what we call this correlation analysis by neighborhood. So this is kind of wonky. People who are not data people may be intimidated by this, but this is what we showed you earlier with the Social Progress Index against the median household income. And what we have found is that sometimes the relationships are really interesting, right? So this is the same exact line graph, the scatter plot that we showed earlier, but we overlaid COVID cases. So what we see here is that our poor neighborhoods, right, low median household income, also bore the brunt of COVID. Right, because that's where you see all the darker colors, and there'll be relationships that you may not, even contemplate. So, for example, we did for the healthcare agency, social index and visits. Relationship that you ask, right? And look, you can dynamically see the relationship is quite positive. Those neighborhoods that go to the dentist more frequently have less COVID and score higher in social progress than those that don't frequent the dentist, right? And so it's just a very, very interesting tool to do some initial analysis and investigation in how different variables impact one another, right? And then what I want to show you is the social progress index itself. And this is the tool that we have various different community members being able to search by their address, right? So you can go into the website here, type in an address, and I'm just making this up. I don't know what's going to come up. Let's look at Anaheim. So I click on that address. Imagine this is your address and this is your census tract that comes up. It gives you the census tract number. It gives you the score and the rank, right? It gives you a nice little summary of the top performing components and the bottom performing components. And then you click on See Scorecard and all of this data is available to you. What do you do with this information? Well, you can go and advocate for your community, right? If you know that you have water issues, or if you know you have a high cost of living here in your community with a lot of housing burden, you can go and advocate for change from your city council, right? This puts the power into the hands of the residents. On top of that, I want to also say that it's in English and also different languages, so that we want to make sure that it's available and accessible to people in our community. We're going to try to continue to add different languages as well over time. But when we launched this, we launched it with the idea that we were going to cover the major languages that are spoken in Orange County. And so it's really interesting that this tool now not only is built for the healthcare agency in managing COVID, but we also can show this to everyday people and then have them be able to understand what are some of the things that are going on in their community, right? How do they talk to funders about the things that they need? And when funders are looking at these maps, now they have an idea of whether or not they're making impact, right? Because those yellow dots will hopefully turn into blue dots over time. Those red dots will turn into yellow dots over time. So we're all on the same page. We're all moving forward and seeing progress, right, as being measured by this map. And this is something that everyone can use universally. So I want to show you this neighborhood map one more time. This is a dynamic map that's on our website. Again, you can search by city. And when you search by city, you only see the census tracts within that city, right? And so the mayor of Anaheim will look at this and go, wow, we are really, really scoring low here in access to advanced education, right? And then what about this particular neighborhood that's kind of out in its own island? What's going on with that particular neighborhood? And then what you do is you track down this number, you go back to our lookup tool, and then you can see the parameters of that specific neighborhood, what streets it covers, you know, where exactly it is within the city of Anaheim. Yeah, and with that, I will stop here, and then I will ask if Hugh is on, if he would like to share a few words about equity initiatives in Orange County and maybe how we've worked together with the county. Do we know?
I'm not seeing him on the participants list right now, unless he's under another name. But
okay, he may not have shown. Yeah.
Yeah.
Okay, sounds good.
So maybe we can follow up with him later after the meeting then. And
sure thing. Sure thing.
Great. So yeah, go ahead and continue.
Oh, okay. So that's basically all I have. Other than we're working on something right now that is a little bit different from our social progress index, which is a youth vulnerability index, right? Because a lot of population health data is on the adult population. A lot of the data that's collected is for adults. And so a lot of times our biggest blind spot is what's happening to our children, right? And pediatric data. And so we are pioneering a new index that's called youth vulnerability. And what we want to do is we want to overlay things like educational indicators as well as mental health screens. Right. One of the things that we don't quite yet understand about COVID was figuring out what are sort of the mental health ramifications of COVID, a year of isolation and a year of remote learning and all of those things, what is going to happen and where are we most vulnerable? And so we are working on this in conjunction with pediatric healthcare providers, as well as school districts, et cetera, to have a better understanding of what's going on with our children. And with that, I will just sign off and answer any questions that anyone may have. And then I just want to share our contact information. It's very simply katie@advancedoc.com, or you can just send us into our general inbox, which is info@advancedoc.com. And then one of our team members will get back to you and share, answer any questions you may have, or we'd be happy to also do a deeper dive with any one of you. Thank you.
Thank you so much, Katie, for that great presentation. There's so much great information there, and I'm really excited to dive into the tool now. So we're going to open it up to questions. We have, I see one question in the chat right now. So Eduardo, do you want to unmute and ask your question since we do have some time? Or I can read it out too.
Can you hear me?
Yes.
Okay, good. My headset doesn't always work. No, my question is really the funding mechanism to support all these equity action items. I think you guys are doing great work identifying where the opportunities are, but as you know, anything that we want to do will cost money. And there, of course, as you know now, there's a lot of resistance to taxes and fees and anything that will extend services, right? That is just the reality where we're at now, right? So my question is, are there funding mechanisms that are being looked at that could maybe have the support of the majority, although technically we have the majority already, but let's say more than 75% of the people who vote, something to that effect?
Yeah, I mean, I think we're operating in an environment where there is a lot of federal dollars supporting this kind of work, as well as the state of California is, creating different initiatives that would support a data-driven approach or evidence-based approach to some of these social issues. And so what we're finding is that there are lots of opportunities to get grant funding for this kind of work. What I think is more important is to have an early adopter who has the vision to be able to implement something like this across multiple agencies and across different use cases, because the data is only good if it's being used, right? We can build like the most fantastic model, and if it sits on the shelf and nobody uses it, then it has very limited benefit. And so what we wanted to do was not just to secure the funding in the beginning, but just to create this partnership, right? And to be able to have the storytelling and the narrative to showcase why it's important to look at this way. In this particular instance, COVID was ever pressing. It was such a huge problem that we all faced across the country that it made absolute sense for us to be able to be precise about our COVID response. And so we were able to use this tool right away off the shelf, as a proof of concept. And that became such a powerful reinforcement, right, of our model and our methodology. And so as a result of that, now we're kind of entering conversations in all kinds of different use cases. Like I said, from food insecurity to housing, the housing element, being one of those things that our cities are looking at. And then ARPA funds that are from the American Rescue Plan that cities are getting directly, right? Many of these cities have never gotten direct funding like this before. And with their $10 million or whatever whatever it is that they're getting, they're looking to maximize the impact for those dollars. And so they're turning to our tool to figure out what are sort of the greatest needs in their community, and they're going to be prioritizing those needs. So it's turning out to be kind of a very useful universal tool.
Thank you so much, Katie. We have a few questions coming in, but I think I saw Trisha raise her hand. So go ahead, Trish, your question.
Thank you, Nita. Hi, because we've been talking about COVID and how things have been very intense in terms of affordable housing, and I just feel that broadband and internet is also a very crucial part of any equity plan. So then my question would be, do you have any plans on including some kind of broadband data or like data that talks about digital divide or accessibility to internet? Yeah, that sums up my question. Thank you.
Yeah, it was part of our index. So it was definitely a category that we investigated in and we look at really closely. And in fact, one of the big priorities from COVID as a result of the remote learning, et cetera, and children not having access or equitable access, right, to be able to participate in day-to-day learning opportunities from a distance was one of those huge glaring inequities that we faced from COVID. And so not only did we measure that, we measured it from broadband access, broadband speed, cellular subscription, as well as those that have no internet access. And we measure all of those things in addition to being able to track who is living in linguistically isolated communities, because those were also communities that were subject to and vulnerable to misinformation. And so we triangulate those things because they're all kind of interrelated, when you think about it, right? And so having this social progress index that covers all of those various different components of our society is really the secret sauce behind this being able to be used by, as many stakeholders as possible in Orange County.
Thank you.
Thank you so much. We have about maybe like 1 more minute. So I'm gonna have one more question from Susan DeSantis, if you would like to unmute, or I can also read your question aloud.
Thank you. Hi, Katie. I wanted to ask if you're aware of any other counties in Southern California who are moving forward through the healthcare agency to do a similar type index.
We're not aware of anyone else doing it similarly. I don't know that they have come across this idea and and have tried to implement it on their own. We would love to share this with anyone and everyone who's interested. We definitely compared notes with people like Providence, for example. They had their own COVID detection tool, and we had our COVID vulnerability index, and we oftentimes would swap notes in terms of where we're spotting COVID and where we're seeing trends. And so that was kind of a fun exercise. But in terms of other healthcare agencies in the region, we're not aware of anyone else doing something similar. But as a result of our work, though, we have heard from a number of different organizations. For example, the American Academy of Pediatrics. They would like to partner with us to use this tool in some capacity to measure longitudinal work and study pediatric care, for example, right? They have a registry, a national registry of 67,000 pediatricians who submit data to them. And so they would like to pair it with our social determinants of health data. So more and more people are starting to see the benefits of this, from a COVID perspective, from a healthcare perspective, but ultimately what I credit the Orange County Healthcare Agency and the Board of Supervisors in Orange County with is this vision to be able to create a platform that can really speak to a variety of different social issues along with health issues. And I think that is where potentially this tool is differentiated, is that not only do we see the trends at the the very high level, but we also see a lot of resolution down to the neighborhood level. And someone just mentioned the Healthy Places Index. If you look at the state Healthy Places Index, you see Z-scores, you see just quintiles or just percentages. You cannot drill it down to a neighborhood, to a census tract, and be able to explore that neighborhood and all the various different components of that neighborhood. So I think that is the direction these tools are heading into, because we are making more and more policy on a very localized level, on a place-based level. And so being able to have that transparency down to the neighborhood level is what's going to be critical.
May I ask two follow-up questions? One is related to your partnership with the county. Could you speak to that even though your partner isn't here on the call?
Yeah, he was calling me on my cell phone. I'm not sure what to, he's the one, he's having trouble. But yeah, we showed this tool as a way to basically help advance Orange County, which is our namesake, right? But when COVID hit, we realized that we could do more than just address those social issues. We knew that we could help navigate, help them manage the COVID crisis. And so when we brought the idea to the Orange County Healthcare Agency, they immediately saw the potential benefit of it. And so they showed it to the chair of the Board of Supervisors, Supervisor Andrew Doe. And he had been looking for a tool like this for 6 years, because he works in sort of the most impacted cities in Orange County, where he saw a lot of suffering, where he saw a lot of under-resourced communities that time and time again just don't get their fair share, right, of resources. And so he was looking for a tool like this, and it just so happens that we came at the right time. And so the county helped give us seed money for this tool. We also privately fundraise for this as well. And in the future, we will also help support the maintenance of this tool by private donations. It's just because we want community stakeholders to be invested in this tool. And this is really a community tool. This is not an advanced OC tool. This is definitely done for the neighborhood.
Your overall budget, what were you able to raise and for the implementation?
Yeah, this tool probably cost us, if we were being true to numbers, because a lot of us volunteered our time, and we actually called a lot of tech companies and said, will you help us in this endeavor? So I don't actually have a hard number to give you, but this is probably $500,000 to do for the county. We had a grant of $385,000 from the county to seed this work, and then we filled in the rest, as well as some of the analysis that we continue to do on this tool for a variety of different purposes.
Thank you very much.
You're welcome.
Thank you so much, everyone, for your questions. And thank you, Katie, for your presentation. It's really, really good information, and I'm so excited. I'm probably going to email you and ask you some more questions. But for everyone else, we will be forwarding the questions that we did not get to Katie. So, and if you do have any other questions, please, her contact information is in the chat. So again, thank you so much. It was such a great presentation. Next up, we have another equity tool that we'd like to share with everyone. I would like to welcome Chelsea Luckenberg from the City of Los Angeles to talk about the City of Los Angeles Equity Index.
Hi guys, can everyone hear me?
Yes.
Awesome. All right, let's see if I can share my screen successfully. Cool. How are we doing? Is this, oh, it's doing that thing again, isn't it? We'll do this. Sorry, guys. 1 second. There we go. All right. How's this for everybody?
Perfect.
Cool. Hi, everyone. That was an awesome presentation, and thank you guys for sharing. I'm super excited to be here and get to work with everyone and connect with folks. My name's Chelsea Luchtenberg. I am the Deputy Director of Innovation for LA Controller Ron Galperin's office. And I'm going to talk a little bit about our equity index today. And kind of similar to the last presentation, I'm just going to walk through our process for development, and then I'll do like a short demo at the end of the actual tool online. So for those who may not be as familiar, the controller was an early adopter of open data and is a self-described data nerd and tries to bring a passion for analysis and leveraging technology into all of the work that we do. We really, anytime we're taking, sorry, hang on 1 second. I'm so sorry about this, guys. Can I actually kick it to somebody? I have a little situation happening here. Give me 1 second.
Sure, I'm happy to. It's Jennifer from AV. I can share your slides if you prefer.
Yes, give me one.
All right, we are experiencing a little bit of technical difficulties right now. So I think maybe if
I'm sorry, can you hear me now?
Yes, yes.
I'm so sorry about that, guys. I'm having some weird tech stuff.
No
the joys
problem.
of working from home. Continue.
Yeah, that happens. That definitely happens all the time.
Okay, jumping back in, and let me just reshare my screen real fast. Sorry, I got kicked off here for a second. All right.
Perfect.
Are we all good here?
Yes, yes, perfect.
So our index was released in November of 2020. It was developed throughout the COVID-19 pandemic. It was a concept that had been floating around for a while and something that we knew we wanted to do. And as COVID-19 really took over and started informing all of the work that we were doing, it became really clear that it was something that we wanted to prioritize and turn our attention to immediately. The index itself is a composite index. It looks at 4 different dimensions and it examines 13 indicators across those dimensions. It's an interactive tool. And I'll talk a little bit about why we landed on the presentation we did, but it's done in an Esri story map. And so it really places both narrative as well as that data exploration side by side. It was something that was really important to us when we were thinking about this concept because we knew we wanted it to both be accessible to policymakers and something that folks at the city and at our department could use when they're making these data-driven decisions. It was also something that we really wanted to get out into the community and have the controller be able to share with his constituents, with neighborhood council members, with community groups. And so we wanted it to be educational as well and to bring in some of that context for folks as they work their way through the index. And so that was really important to us as we were thinking about it. It looks at census tracts throughout the city of LA, and it also is aggregated up into the neighborhood council levels. So essentially, as we started talking about this, our priority was really to increase equity at the city. That's been the undercurrent of the work that we've been doing for a long time. We look at that both internally at the city, and we've done reports on pay inequity. We've talked about how we can move the city towards a more inclusive contracting system. We also look at it externally in the way that the city serves Angelenos, right? And so we think about improving parks and green space. We look at providing opportunities for youth development. And so as we, have taken that lens into our work, it really became clear that we needed to create a holistic view of equity and opportunity at the city that would complement those reports. And it would also allow us to kind of take that work to the next level, and especially when we're making these recommendations to council, and when we're thinking about the best use for funds across the city and making those increases in equitable outcomes. As we kind of moved beyond that initial concept and really started researching and putting together this tool and pulling some of the data that we were going to be using, we thought a lot about who our audience was. We knew that we wanted this to be something that the city could use as it was starting to target investment into communities that had historically experienced divestment and that were experiencing these barriers to opportunity. We also knew that the controller was going to interface a lot with these community members. And so we really wanted it to be something that was interactive, that was clean, that was going to be something that we could iterate on and continue to kind of share and collaborate on with community members and with city folks alike as we went about it. As we kind of got into it, we pulled data from a number of different sources. We have American Community Survey data in there. We have data from USDA. We have data from the CalEnviro Index. And we also pulled in quite a bit of population and demographic data, as well as some explanatory variables. For us, and I think, this is something that I'm sure we will talk about at this group, but we're not under any delusions that we have captured every factor that influences equity in this index. We know that this isn't an exhaustive list, and we know that there's a lot that goes into what affects opportunity in each of the neighborhoods throughout Los Angeles. As we were developing this, we really zeroed in on how we were going to examine and define equity. And because we knew we weren't going to be able to develop that exhaustive list, both because of bandwidth and just the scope of the work, we spent a lot of time researching and identifying the dimensions and the indicators that are particularly potent, especially in Los Angeles, when it comes to what is affecting Angelenos. And so we landed on these 4 different dimensions. We looked at socioeconomic variables, and that includes things like home ownership, the percentage of people living below the poverty line, people who are experiencing rent burden, as well as severe rent burden, which is incredibly high, as we know, all across SoCal and especially in Los Angeles. We looked at education variables, including both elementary proficiency rates, as well as high school graduation rates and college graduation rates. And we really thought a lot about how we were going to weight those different variables in terms of the final composite index. We looked at environmental impacts, including exposure to toxic releases, traffic density, which again, it impacts some parts of LA particularly acutely, air quality, which you can see highlighted on the screen. And we also looked at access to resources, including internet access, as somebody mentioned the last time, the digital divide is particularly acute, access to health insurance, access to grocery stores. And we also spent some time looking at, there are other iterations of projects similar to this that have been done both in LA City and LA County. Spent a lot of time looking at opportunity mapping and some of the other national projects that have come around, and really tried to incorporate and build on that work as we were constructing this. This was done with a fairly small team. It was done entirely in-house with controller staff, with our innovations and our communications team. It took us about 6 months from concept to release. Part of that was because none of those folks were 100% on this project. They were balancing other projects as well, including everything that was happening as a result of COVID. And so because it was done relatively small without really a formal budget, one of the things that we've always been excited about and interested in is iterating on this and thinking about ways to kind of collaborate and expand on this. It has been received really, really well at the city already, and we've had a lot of different departments reach out to us about using the data to make policy decisions. We've also had a lot of community groups, including nonprofits and neighborhood councils, who have reached out to us to use it. And we've already gotten great feedback on what folks would like to see in it, what they find particularly valuable and useful. And so it's been a really exciting release, and it's something that we're hoping we can continue to kind of work with the city to institutionalize and build on, so that it's a product that outlives the controller's tenure, that outlives, all of the current electeds' tenure, and becomes a part of the city decision-making process, which we're stoked about. As I've mentioned, it's been used for a few different projects, some of which I can highlight. There have been some folks who have been looking at it for capital building under municipal facilities grants. We have been using it in our own projects as we produce audits and reports, whether that be looking at COVID-19 and the impact on our communities, both from just where cases and deaths have been particularly acute, as well as things like where job losses were most, felt throughout the city of Los Angeles. We've overlaid that with our equity index, and unfortunately, but to probably no one's surprise, have found that those are really compounding factors, right? And that COVID-19 has hit the areas that already had the most barriers on our equity index the hardest. And so we know that those are the communities that we need to be targeting and uplifting and directing city services and investment to. We have also, as I mentioned, had a few neighborhood councils, as well as other similar neighborhood groups who have actually reached out to us and done walkthroughs and workshops around how they can use this equity index and really dig into the data that represents their communities and start to use that as an advocacy tool in their work as they start to advocate for what their needs are, which is really exciting and definitely something that we were hoping to see for this. So as we kind of think about, iterating on this, we're in talks with a couple different departments within the city, as well as with some folks outside of the city, vendors, as well as some just data governance groups, about how we can expand on this and really bring it into our work and the work that the city does on a day-to-day basis. As I mentioned at the top, the controller is really passionate about data, about analysis, about really utilizing those to make the city more transparent, to make it more efficient, and to ultimately make it better serve Angelenos. And we know that there's always improvements that can happen there. And so we really see this as a jumping off point. And we know that this kind of data and this kind of analysis can really drive that decision making and ultimately improve the outcomes for our constituents, and make the city, ultimately serve everyone better and provide more equitable outcomes. I want to just quickly kind of take you through a demo of the index itself. And I'm hoping that this works. Let me share my browser. Cool. All right. Can you see my browser screen here? I'm going to
No,
Not yet.
No? Come on. There we go. Cool. I see a head nod. I'm going to roll with that. So this is our story map. Like I said, this is both narrative as well as kind of bookended with the composite index. I'm not a believer in reading things out loud to people. I used to be a teacher and that drives me crazy. So I'm going to let you read this narrative on your own, and I hope you do at some point. But essentially what we have is at the very top, this is our composite index, and it allows folks to, I've entered in an address here, come in to their census tract and see what their composite equity score is and see how that's influenced by those 4 different dimensions, as well as a demographic breakdown of that census tract. So this kind of gives you the overview of everything. And then we really kind of take people through what those dimensions are and kind of try to explain how each of these impacts their city and their community. And one of the things that sticks out to folks, right, is that no single neighborhood on here scores lower than a 4 on all 4 of these dimensions, right? And that's something that I think we intuitively know, is that these dimensions, like access to a high quality education versus how you are harmed by environmental impacts, they vary widely, even across a matter of city blocks. And so it changes with each of these indicators, and it's something that people always find really interesting. I'm not going to take you too deep into each of these, but we walk through each of these different dimensions, and the kind of final piece of this that bookends it is the equity index aggregated up at the neighborhood council level. And so this lets folks, kind of gives people a sense of the neighborhood and where they are, and lets people, again, dive into that and find what's closest to them and how these are impacted. And it breaks it out a little bit deeper for people in this final piece. So that's the equity index. I can drop a link to it in the chat after this, as well as my contact information. I'm happy to answer any questions that anybody has about process, about use cases, whatever's on your mind.
Thank you so much, Chelsea, for demonstrating your the equity index. Again, another great resource. Are there any questions? I don't see any questions in the chat as of right now, but we did drop the link for the tool in the chat.
Oh,
So
thanks.
yeah, of course. So if you're interested, please feel free to play around with the tool, and we're opening this up to questions. Does anyone have any questions at the moment?
Chelsea, I know you said that this tool had some implications potentially for funding. Is that right?
So
Funding decisions?
oh yeah, for funding decisions at the city. Yeah. So we have had departments start to utilize this data and this tool as they start to make investment decisions, particularly with all of the money that has started to come into the city through both CARES and the American Rescue Plan.
This is Eduardo. I had my hand raised, but I don't know if I did it right. In terms of investment, do you know if there's a plan to use this type of index or something like it to inform transportation investments? Because those are a major chunk of money that the city, the county, and the region get, and equity issues are for center and front of transportation investments, but I'm not sure if they do this level of analysis that I'm seeing today. I was wondering if anybody can speak to how this equity index or something like it being used in the regional transportation decision-making process.
Yeah, that's a great question, and I agree with you. It is, there are issues of equity front and center for sure, and that, off the top of my head, I'm not specifically aware of a use case using this or a similar equity index, but that certainly doesn't mean it's not happening. But I am not aware of a specific case of that, but somebody else on the call very well may be.
This could be a SCAG issue, and I don't know if anybody's on a call from SCAG, the MPO for Southern California.
Right.
And I know each county has quite a bit of authority, like OCTA, LA Metro, and each of the counties have their COGS or whatever, looking at transportation investments. Because to me, part of the issue with transportation and the inequity is we've invested in the last, I don't know, 50, some 60 years, maybe longer, on what is considered the white middle class suburban areas, not just here in Southern California, but throughout the United States. In fact, I can tell you that a lot of our legacy models are based on things that were done in the 50s and the 60s, which really assume a certain demographic, which literally is no longer true or valid. And I know in transportation research, we're trying to update all our models to really capture a lot of the diversity and equity issues in our demographics so that we can give data to our transportation investment agencies so that they don't go the same track where, okay, we're only going to look at transit if it's viable for the middle class. Well, what about the lower income class who really depend on it, right? Or bus routes that are not lucrative because, they don't have the ridership. So to me, transportation is such a key component of how we could address equity on a neighborhood level. And I was just wondering if you are aware if that conversation is happening now, because I see a lot of talk in healthcare, which applies to our transportation and land use decision-making process.
Yeah, I couldn't agree with you more, Eduardo. I wonder if anyone from SCAG has any thoughts that's on the call or has any better insight into Eduardo's comments.
Thank you, Eduardo and Chelsea. I think I could take a stab at it. So we are starting to plan for our 2024 Regional Transportation Plan and Sustainable Communities Program, or sorry, Sustainable Community Strategy. So we are going to incorporate more equity into the regional plan. So we do have those plans, and we will be reaching out to our stakeholders and different communities to see how we can meaningfully incorporate equity into there. As for an equity index to inform transportation planning that is also in discussion, and one way to incorporate more equity into transportation planning. So it's definitely being talked about, and we're more than happy to continue this discussion after the meeting to get more of your input on it. But it's definitely on the table. And if anyone else, yeah.
Oh, this is Courtney from SCAG too, and I should just quickly add that we have shared some guidance with our county transportation commissions, some recent research that has been done, a full sweep of sort of national best practices or practices right now for county transportation commissions and equivalent agencies who are evaluating projects for equity. And so we have shared some of that research and those practices with our CTC so that they can become aware. But as Anita described, I think that this is going to become an opportunity really going forward for a lot of discussions with our stakeholders about how we can better integrate equity within our long range plan. It's why we formed this group, to have these discussions. And so hopefully, Edward, if you haven't already, maybe you can email us your contact or message us in the chat, and we can get in touch with you after the meeting. And then Katie, I just have one last question. I think we're probably at time, but Katie, I'm wondering, how often do you anticipate refreshing this story map? Because that's an ongoing concern, right? Is that we want to share a lot of data, but there becomes a lot of pressure, right, at different points, right, to do updates. Do you have a sense of how often you'll be refreshing it or refining it?
Yeah, we're constantly refining it. In fact, we're waiting for Census 2020 data to drop. As soon as the full set of data drops, we're going to do all kinds of analysis with racial data, with age bracket data, with all kinds of different data that's included in the Census 2020. And that is expected at the end of the year. So we are already prepping our dashboard to contain and reveal those insights, as well as things like, we really want to focus on small businesses, and a lot of our communities of color, for example, had a lot of closings of small businesses and micro businesses. And when we think about recovery efforts, where do we want to focus our resources? Where do we want to focus our attention? Can we talk about sort of the new urban planning model of 15-minute cities, that kind of thing? And so there's so many iterations of this kind of place-based analysis that we can certainly do. We're being asked all the time by a variety of different people, including like this CalAIM mandate from the state of California with mental health and behavioral health services, being able to identify mental health resources in our community. So the asks are plenty, and we would just love to be able to partner with other folks who are also doing this work, because it doesn't make sense for us to create this in a silo. We really should create this as a regional tool.
Thank you, Katie. And that question goes for you too, Chelsea, as we wrap up this segment, I would say, on our indexes. What's your process for doing updates of the data?
Yeah, we also have our eyes on the upcoming release of census data, and we know that some of the other data sources that we use, like Cal Enviro, are also in the process of updates. So we're definitely excited about that and looking towards how we can update and potentially even build on some additional factors. And kind of similar to what Katie said, we're really looking to identify some potential collaborators and expand on this, specifically our Civil and Human Rights and Equity Department, which is newly formed at the city, and really see it as a way to kind of institutionalize the tool and have this hopefully be updated every year moving forward.
That's fantastic news. I'm so excited to see all the updates as well. It looks like I have a lot of homework to look at all these wonderful tools after this meeting, but thank you so much, Chelsea, for an amazing presentation on the City of LA Equity Index. And your contact information we will also provide in the chat, as well as it will be provided in the presentations. So if anyone has any further questions for Chelsea, please do not hesitate to contact her. Thank you so much, Chelsea. Next, we have we want to continue to highlight local efforts to advance equity. So I do see Katie Balderas on the in the call right now. So we'd like to welcome Katie from the city of Long Beach, who will be sharing more on their recent efforts to advance equity in the city. So welcome, Katie.
Great, thank you so much for having me. Hi, everybody. I'm Katie Balderas. I'm the equity officer for the city of Long Beach, and I've been in this role for about 5 years, which is really when the city started more deeply investing in our equity work. So I'm excited to share some of it with you today, but also really more focused on our framework for reconciliation and the racial equity initiatives that we've been leading that have really catalyzed more over the last year. Next slide. So following the murder of George Floyd, City Council, the Long Beach City Council called on staff to respond to the framework for reconciliation and to really do this in partnership with communities. So the framework consists of 4 key components or steps to address systemic racism. And I'll go into a little bit more detail about each one of them throughout the presentation. But just at a high level, it included acknowledging the existence and longstanding impacts of systemic racism in Long Beach and in the country, listening to accounts and experiences of racial injustice, inequity, or harm to community members, convening stakeholders to analyze feedback from the listening sessions and including all the racial disparity data to recommend initiatives that would shape our policy, budget, and charter and programmatic reforms. And then finally, catalyzing action that included immediate, short-term, medium-term, and long-term recommendations for City Council. Next slide. So just to kind of make sure that we had a strong focus, it was really important that we had a clear vision, mission, and some core values for the team that worked on this process. Just for some background, many of us who worked on this initiative, we were already mobilized in the city's Emergency Operations Center for the COVID-19 response. We had formed an equity team in the Emergency Operations Center for COVID. So we were quickly able to pivot shortly after George Floyd's murder to work on the framework for reconciliation. So our pre-existing equity work was able to just shift into this. So we had a team that came together to really create this vision and these values, where we wanted to make sure that race and ethnicity alone do not determine our social or economic outcomes for those who live and work in Long Beach, and that we're actively involved and engaged in ongoing racial reconciliation initiatives to dismantle and eliminate systemic racism, recognizing that the necessary starting point in this country is dismantling anti-Black policies and practices, institutions, and replacing them with those that ensure racial equity for all. So we valued our history, as uncomfortable as it may be, the wisdom and experience of Black people and other people of color. We lead with compassion, with empathy, trust, humility, transparency, and accountability. As I mentioned, leaning into that uncomfortable history and data, which I'm excited to have seen some of the data tools that have been shared to help drive these conversations in LA and Orange County. And then we also firmly believe that when we center anti-Blackness as one of the most disparate outcomes in our country, just based on our history, that it also can address some of the racially disparate outcomes for our Latinx, Cambodian, and other communities of color, our Indigenous communities, other Filipino communities as well. And we center race explicitly, but not exclusively. So this is not to the exclusion of people with disabilities or gender or sexual orientation or identity. It's really just that we are leading with race and we're not going to shy away from the topic, just understanding how it intersects with all other forms of oppression and identity. Next slide. So in terms of acknowledging the history of race and racism in our city, I didn't share any background, but my background is a public health professional. I have my master's in public health from Cal State Long Beach, and we have started the conversation around equity using public health data. It's something that people come together around. It doesn't, people care about having a healthy community. So we were able to really use the public health data to understand the root causes of the issues that we seek to address. So in Long Beach, and just like other cities in the country, data shows that more often than not, Black people and people of color have the poorest health and social outcomes due to systemic racism. So here in Long Beach, we see that Black residents are hospitalized for asthma about 9.5 times more often than white residents. Asian Pacific Islanders are hospitalized for asthma 3 times more than white residents. We see that among full-time workers, white men are nearly twice as much as Latino women. And about a quarter of very low birth weight babies are born to African-American mothers, although they only make up 13% of the population. And then in Long Beach, white families are about twice as likely to own their homes compared to Black families. And this data set does not include disaggregation of our Asian Pacific Islander communities. So when we look at our Cambodian community members, they have an even lower homeownership rate at around 23%. So it's really important to be able to disaggregate the disaggregated data even, especially with our API communities. Next slide. So as I mentioned, the Office of Equity has been around since 2017. So all of the work that I'll share today has really been the result of seeds that we sowed many years ago. So the Office of Equity started in the Department of Health and Human Services in Long Beach. We are one of 3 jurisdictions in California that have our own health department, and we're very fortunate to do so because we are more responsive in many ways than county agencies are able to with their big size. We also participated in the Government Alliance on Race and Equity. We started that in 2015 before I began with the City of Long Beach, and that really is what led to the creation of the Office of Equity and a shared understanding of government's role in dismantling racism and systemic racism at that. We created the Equity Toolkit for city leaders and staff, and I'm going to drop that link in the chat. I'm just going to drop a few different resources and things we've developed over the years. We also developed infographics. So I loved how LA, Chelsea, you shared that narrative is really important. When we present data alone without providing that like context or that historical lens, we allow people to continue to draw their own conclusions about why those disparities exist, which often results in individualistic terms like behaviors or assumptions about people, specifically about communities of color that are not quite true, because we know that they are often rooted in policies and practices or land use decisions from our history that have resulted in some of those outcomes. We also developed a policy profile with policy link and USC. And then the last link I'm going to drop in the chat, sorry for so many coming at you. We developed a community health needs assessment dashboard that helped kind of connect some of this narrative to our local health and social context data. So all of this to say, like, we started from a place where we had a lot of tools, we had a lot of language and resources around how we were able to build upon this work and really catalyze into action, including a strong economic and digital inclusion platform, and a strong focus on diversity in recruitment and in hiring. Next slide. So part of the acknowledging piece was also acknowledging the history of racism in Long Beach. We declared racism a public health crisis, along with many other public health agencies. And we are working with our Development Services Office, or those who focus on long-range planning, to really strengthen our city's historic context statement, incorporating topics on race and suburbanization as they're looking towards historical preservation decisions. Next slide. So the listening and convening piece, we were busy last summer. We did a lot of Zoom town halls, listening sessions, surveys, email input. And when it came time to analyze that data, we partnered with a professor and a team of students from Cal State Long Beach, and they literally coded and transcribed or took the transcripts from all of the Zoom chats and Zoom sessions that we had recorded and analyzed those and really broke it down into some thematic areas that we were able to then share with stakeholders once we convened them. We did 2 stakeholder meetings, and then the stakeholders consisted of a much smaller subset of people that participated in those listening sessions that really wanted to dig into the weeds with us. And then from there, we even formed a smaller ad hoc work group of people who were like in a Google Doc editing recommendations and whatnot. Next slide. And so from all of that listening, convening, and data analysis, we ended up with a report that's quite robust, but it really centers around 4 main goals. The first goal is really what we call getting our own house in order, ending systemic racism in Long Beach and all local government and partner agencies through internal transformation. The second goal is really responding to the need for safer communities that don't necessarily require police to be involved. And we know that a lot of times police are responding to basically cracks in our social system, our social network, like poverty and trauma, and not necessarily needing to be the first line of response, but because that's what we have, that's all they are, or that's all we have. And so that's what they do. So we really want to design in a more upstream approach to community safety and violence prevention. Goal 3 is around actually redesigning the police approach to community safety. Goal 4 is kind of everything else, where we want to improve health and wellness in the city by eliminating social and economic disparities in the communities most impacted by racism. Next slide. So we have a few accomplishments that I'll highlight based on what we've done over the last year. I will say that there is a lot of stuff. That's the other item that I'll drop in the chat is our reconciliation report. It's really long and it would take me forever to go through it with you all, but I just will scratch the surface and share some highlights. So one highlight is that we moved the Office of Equity to the City Manager's office so that we had a much more department-wide approach. And so now I'm in the department head meetings, having access to partners like Public Works, HR, Finance, etc. We appointed equity champions across all departments. And in those equity champions, they are facilitating Racial Equity 101 for their respective department staff. As of right now, we have 800 city staff who've been trained out of our 6,000. So we still have a ways to go, but given that we have not brought in an outside consultant to do this work, we're pretty proud of the impact that our champions have made so far. Some of the champions are stuck at the point where they're trying to really just figure out how they enter into the conversation, because race and racism are still very difficult topics to broach in their departments. Some of them are stuck just at the sheer size of their department. Some departments have, 1,000+ staff. So there's a lot of challenges in still rolling this out. Our city council also adopted a advisory commission to kind of shift to focus on equity. It was our human relations commission that focused a lot more on interpersonal dynamics, and now is focusing to look at systemic and structural policies related to equity issues. And then some things that are in progress. We have a policy work group focused on workforce equity, really, again, getting our own house in order and recognizing that we can't advance equity in our community if our city employees don't feel heard, valued, like they can show up at work in their full selves with their lived experience and really be truly valued. We've also been partnering with Harvard Kennedy Government Performance Lab to do an extreme makeover on our procurement process and small business outreach, so that we know we have a much more equitable process for how we get government contracts into the hands of businesses that are owned by people of color, women, or people who just, maybe entrepreneurs and not know how to navigate the city's procurement process, because it's not easy. And then finally, those racial equity champions I mentioned are developing racial equity action plans using an anti-racist results-based accountability process, where we really dig into the root cause analysis of the data, and we really try to dig deep into understanding how white supremacy has resulted in the outcomes that we see across all measures of well-being. Next slide. The second goal is, again, around this upstream violence prevention, community safety. And so part of why last summer was so rushed was because we were trying to align with the city's fiscal year. So we basically did the process of listening, convening, and reporting back to city council between June and August. So if you know government, like how slow things move. That was just an amazing pace. I think we're all still recovering from that because it was a lot. But through that budget process, the city council directed $1.5 million to go into some of these new investments for community safety, violence prevention, youth development, and health equity. So we are excited to launch a new Office of Youth Development. The meeting I was trying to listen in on just previously was a meeting related to setting up an alternate response model for mental health crises. That doesn't involve police responding, but has a community response team who can attend to those things. We already have a team that responds to homeless calls for service. And so now shifting that to also focus on mental health calls for service is another important goal. We also have some great work happening around our Advancing Peace initiative, which is our previously known as Safe Long Beach Violence Prevention Initiative. Activating Safe Communities is really focusing on a neighborhood level, block by block community safety strategy. We are focusing on building out a re-entry network for people who have been affected by the criminal justice system and are returning back to our community. And then our strategic plan for youth and emerging adults is being implemented with that Office of Youth Development. Next slide. And goal 3, again, is related to police accountability and oversight. And so one of the items that we're working on is related to our Citizens Police Complaint Commission, or CPCC. Just small changes there so that they have access to more information, including officer compelled statements. The police department also put forward an early intervention program to use data as a way to track potentially problematic behaviors among their police department. It could include things like complaints or other metrics of performance. It's really just intended to identify any red flags before they result in any major challenges or liabilities to the city. In progress, our Citizens Police Complaint Commission is doing an independent outside review to overhaul, and we're trying to align this in time for our next election cycle so that if we have to go back for any charter changes, that those are able to be done or advised in time. Our Technology and Innovation Commission is reviewing the facial recognition technology that our police department uses to investigate crime. We're working on police hiring process improvements. The police department has partnered with the Center for Policing Equity to build out a data dashboard. We partnered with the Lewis Registry, which is when law enforcement officers go from one agency to another, they could have participated in problematic or bad behavior, been fired, and other agencies don't have any way of knowing unless and so the Lewis Registry helps them flag that much sooner in the process, so they don't have to go through the hiring process and then find out that the person's been fired. And then, just like I mentioned, we're working on mental health crisis response. We're partnering with Harvard Government Performance Lab, again, to do this, and allocated some ARPA or Recovery Act funding for this to pilot. Next slide. And then goal 4, we used a lot of our CARES Act dollars to really invest in health equity, digital inclusion, economic inclusion, really focus on business support, getting tablets and laptops and hotspots into the hands of families that needed them. We invested $1 million of our CARES Act into a Black Health Equity initiative that funded Black mental health providers to serve clients, did a lot of vaccine outreach specifically focused in our Black community, as well as other communities. Our CARES Act was just used in a really robust community investment strategy. And then currently in progress, we are working on administering our recovery funding. We call it Long Beach Recovery Act, so LIBRA, programming all done with a strong equity lens. The city is adopting our Climate Action Adaptation Plan, which also has a strong equity lens. We've really doubled down on economic inclusion, digital inclusion, health equity, and cannabis equity strategies, probably more than I have time to share. Next slide. In order to implement all of this work, we had to develop a structure. The Office of Equity is small. For years, it was just me and a language access coordinator, and now we have 2 full-time language access coordinators, 2 program specialists, but we really built out a strong racial equity leadership team that includes the co-leads from each of these work groups here in the gray boxes. So our internal transformation team, this is really made up of our equity champions. These are the ones doing racial equity 101 trainings, developing the racial equity action plans for their departments. Our data and performance metrics work group is working on equity profiles for council districts and a lot of other cool ways that we can better collect data using an equity lens. And then our policy work group is focusing on best practices for our workforce equity. Communications work group kind of helps support us just in communicating everything out. Community engagement work group helps support us engaging our partners and staying in touch with our stakeholders throughout the process. And then our special projects work group is really focused on the mental health response model. And we are in the process of developing our racial equity community advisory group and our racial equity advisory group, which is made up of department directors, really the leadership that we need in order to make this happen. Next slide. So some next steps that we're working on, it's been a year, it's been a big year, but we are working to wrap up a 1-year report so that we are accountable to community for all the things we said we wanted to do, giving them an update on where we're at and where we're going. In the process, as I mentioned, of developing those community advisory committees and department advisory committees. Next slide. That should be my last slide. Okay, so I am under the deputy city manager now in the office of the city manager. And so it's that is her name. I usually co-present with her, but she was not able to make it. But I'm happy to answer any questions or share any additional information. I know that was a lot in a short amount of time.
Thank you so much, Katie, for that. We do have one question in the chat. So Eduardo, if you want to unmute, you can go ahead.
Yes, I was just wondering if like Long Beach has any current initiatives to address the systemic discrimination that financial institutions have used historically to really limit, if you will, the opportunities given to Black people, but also now other people of color. I know it's a private industry, but I was wondering if the city is able to use its if you will, authority and in fact resources to address that. I think it's a critical inequity that still exists today.
Absolutely. I mean, you can just drive from one side of the city to another and see banks on one side of our city and check cashing places concentrated on the other. We have areas of Long Beach that don't have a full service bank still. So, I mean, it's a good question. I don't think I have all the details I probably need, but a couple ideas that come to mind are really what the city can do to invite full service banks to come into the communities where they're currently not providing services, I think is one strategy. So if there are any kind of incentives that the city can offer to help make that easier, that's certainly one thing. I know that our Vice Mayor Richardson from North Long Beach was instrumental in helping us secure a Chase Bank up in his district. But currently on the west side, I don't think we have a full service bank, which is really unfortunate. The other, arm, and I think this might be in the reconciliation report, is really how banks can use their CRA, Community Reinvestment Act funds to invest back into communities. I'm not sure, I honestly don't know much about that, but I think that there's a lot of potential there. And if the city can figure out ways to partner with them, I think that's definitely an opportunity that we need to explore more, but not my area of expertise.
Thank you so much, Katie, for that response, and Eduardo for the question. I don't see any other questions in the chat. Does
Katie, I have a question. Sorry, Anita,
Courtney.
it's Courtney again. So you've described a lot of work, and it's obviously very impressive, and I'm sure it's a lot to have gotten to this point. But for those who are not as advanced, in their work, this is the question that comes to mind, and we've been asked at SCAG, is where people start. I mean, honestly, we often refer people to GARE, the Government Alliance for Race and Equity, but I haven't yet come across a toolkit or a guide for how to start advancing equity in a city. And I'm wondering if you have any tips on how folks who have not, made such considerable progress, how they start the work.
Yeah, that's a really good question. I think, and GARE is great, but it sounds like they're shifting how they approach the work. And so one of the advantages that we had in participating in their cohorts that they had was that it forced us to really reckon with our history, because one of the first assignments they give you is go back and do the city's history of racism. And so it forced us to talk to elders in the community, build relationships with some of the historians, especially the historians who don't necessarily share like the white narrative, and really gather that and really internalize that as a city. And I think the other piece is reckoning with the history of harm that the city itself has caused. And that's one of the harder parts. And just in thinking about how far we've come in the city of Long Beach in my time, there was once a land use document that I helped draft that was helping to provide some health equity analysis to our land use element. And it made reference of the term redlining, and it was redlined out of the document. People weren't ready to reckon with our history of redlining in Long Beach. But I think for me, especially as a white woman coming into this work, it's been super helpful to dig into the history. So one of the strategies that I've used is using data overlaid with maps. So if you take a look at the equity toolkit, not the equity toolkit, I'm sorry, the equity infographic that I dropped in the chat, one of the slides shows, let me see if I can share my screen really quick. Okay. So this slide, this is something I adapted from a slide deck, but it used to walk through like low income, people of color, where our future generation is growing up. So I had all of these slides that kind of layered on top of each other to show like, you know, where are low income communities concentrated, showing that they're predominantly our communities of color. Where are our children under 10 growing up, and recognizing that that's our future. Like our future is rooted in the well-being of these children. If we don't advance racial equity, and if we don't like really take a cold hard look at this, then we're going to have problems 20 years down the road. And so from there, also layering that on top of the redlining maps. So for a lot of people in government, they were unaware of redlining, but when you really start to understand the impacts that land use and governmental policy have had, it can open up a lot of conversations around what our role is in the harm we've caused and our responsibility to fix it. And there's a great video that's based on The Color of Law by Richard Rothstein. It's a 17-minute video, but like it's chef's kiss. It's an amazing tool for bringing staff together to talk about how you get started. And then from there, like the wisdom is in the people in the community and the people who are doing this work within the city. So I really think that having that shared leadership has been helpful for us as well.
Thank you, Katie. That's fantastic advice. We have another question from Eduardo.
Yes, something that Katie had mentioned about the children, the future of our country and our state, our country and all that. In Long Beach and specifically in LA, I don't know if anybody from the city of LA, are there initiatives to address the quality of education of our K-12, which is where we actually pre-K and then K-12, which is really where we need to address the most fundamental equity issues, in my view, because we have kids who are growing up in such position of disadvantage or lack of privilege that, you know, the next generation is where we could make significant progress in terms of, you know, upping people's quality of life and all that. I was just wondering, does the city of Long Beach and LA City and Orange County have actual programs on the ground now to address the inequity in the quality of our pre-K and K-12 education in Southern California? Because to me, that's where the battle is.
Yeah, absolutely. The city of Long Beach often jokes that we share custody with the school district, but we don't actually influence like the school district policy. So we really see our role in the children of our community is really, you know, community safety, the libraries and the services and programs that they offer, especially around like the 0 to 5 age, and then our parks and rec opportunities to help connect to the schools with after school programs, again, like some of the recreation. But honestly, I feel like the systems are still very siloed and very fragmented, and I feel like it starts with relationships, and one of the relationships we've come to foster is with a deputy superintendent who's leading the school district's equity work. So we're really starting to forge a bond that I think will help us like figure out like what is our connective tissue in a more meaningful way related to young people. And then I think, you know, within our youth, the city signed on to My Brother's Keeper, which is an initiative that President Obama started focused on young men and boys of color. And, you know, taking an equity lens to our youth means we have to focus on those young men and boys of color too. Because when you look at everything from graduation rates to rates of gun violence, then we know we have to really do some healing and focus some attention and love in that group of boys. So, I don't really have a great answer, but I think we just need more investments and more focus on our kids. The other thing that has been helpful, I think, especially in seeing for well-intentioned white people, especially of the older generation, the National Equity Atlas has really created some great narrative around the racial generation gap, because research has shown that as the white population that has a concentrated wealth gets older, that they stop investing as much when the younger population is mostly consisting of youth of color. And so we can almost predict that as that racial generational divide grows, that we'll start to see that there's pushback around investing in youth. And so I think it's really important that we be aware of that data point and that we use that as a point of pushback. So for what it's worth.
Can I add something to that? You know, we oftentimes see policymakers, and when we meet with different, you know, collaboratives that contain elected officials and CBOs and you know, other folks in the community, we often talk about groups of populations in our community, and the solutions that inevitably come up and arise to the top are very general. It's food insecurity, it's disconnected youth, it's, you know, XYZ, right? But what we found in doing our data work is that poverty looks different in every neighborhood. Inequity looks different in every neighborhood. So it's really important to take a look and take an assessment of what it is that, you know, afflicts that neighborhood, that community. And so that is sort of the orientation that the County of Orange is taking with these issues, is that are we talking about lack of childcare facilities in this community? Or are we talking about disconnected youth who are not employable and are not in school? What are we talking about when we talk about our youth and the issues affecting our youth? So really dismantling the issue and being able to see it at a neighborhood level is important.
Yeah, absolutely. Thanks for pointing that out, Katie. I like your name.
Ditto.
Thank you so much, Katie and Katie. Are there any other questions for Katie? All right, thank you so much for your presentation and for Katie's presentation on Advanced OC and Chelsea's presentation from City of LA. These are really, really great resources. We have so much information in the chat, so please take a look at all the links and all the resources that have been provided. Thank you, Katie, for providing your contact information too. So if you have any questions, please feel free to contact her. Again, thank you so much, three presenters, for wonderful, wonderful presentations on advancing equity and all the important points that we really need to discuss. All right, so now we have our last two agenda items. And we have about 15 minutes, so I think that's perfect timing for us. We're going to shift gears a little bit to talk about a funding opportunity with SCAG Sustainable Communities Program. So Jennifer, all right, perfect. Next slide, please. All right, so SCAG's Sustainable Communities Program started in 2005 and aims to provide resources and direct technical assistance to local jurisdictions. We've already completed 3 calls for applications in the 2020 and 2021 cycle on smart cities and mobility innovations, housing and sustainable development, and active transportation and safety. So SCAG will release the 4th and final call for applications for this cycle for programs and projects that center on civic engagement, equity, and environmental justice that will be released in spring of 2022. Next slide, please. So the Sustainable Communities Program, or SCP, has 7 overall goals, which I'm not going to read all of them, but a few that I want to highlight would be to provide needed planning resources for our local jurisdictions and stakeholder groups, as well as promote, address, and ensure equity. Next slide, please. So this fourth call for applications will focus on and prioritize historically disinvested communities in transportation planning efforts. We do want to support a wide range of transportation and housing supportive infrastructure programs and projects to help close the gap of racial inequities and support SCAG's existing equity efforts that are outlined in the Racial Equity Early Action Plan, Connect SoCal, and Public Participation Plan. So we hope that this fourth call will help implement programs and projects that eliminate barriers to civic engagement and build and sustain community capacity and trust in these prioritized communities like SCAG's Communities of Concern and SB 535 disadvantaged communities. So again, I don't want to read all the goals and objectives of the this specific call, but because we want to center on civic engagement, equity, and environmental justice. Those goals and objectives are very important for us to point out, as well as have applicants consider when they are applying for this call. Next slide, please. So there is a wide range of potential projects that can align with this call's objective, including the 6 of these. So we have AB 617 implementation, which focuses more on community air quality monitoring, SB 1000 EJ elements and policies for general plan updates for local jurisdictions with disadvantaged communities within their borders. We have connected communities, which are projects that align land use and transportation strategies to increase accessibility, mobility, and safety. For example, you can have projects that are related to access to broadband or safe routes everywhere. And then we have safety and community, which are projects that support community ownership, equitable access to resources, and shared trust between government and its constituents to allow for partnerships at all levels, addressing the complex and multi-layered influences to promote safety and community. So some examples could include planning convenings that bring together residents, community stakeholders, and public agency representatives to discuss safety and identify planning solutions. And then we have community engagement and capacity building, which are projects that promote public dialogue to change narratives and advance possible policy solutions addressing historic support, community dialogue and reflection, or projects that support restorative justice, leadership development, creative arts, and other trainings positioned within environmental justice areas and planning. So some examples could be like community healing spaces or dialogue, healing dialogue areas, and community storytelling to inform planning efforts. And then lastly, the parks, green, open, and public space type of projects, which include planning projects that develop and improve equitable access to parks, green, open, and public spaces. And we want these projects to also consider building community connections, capacity, and social capital through parks, green and open spaces. So some examples could be public and pop-up programming, improved culturally competent directional signages, which is something that could really benefit communities that are lacking in that. So the application guidelines are still in development. So more details on eligible projects will be provided at a later time, but these are some potential project areas that can be considered for the application call. Next slide, please. So for this call, we prioritize projects that reduce VMT focused on equity and environmental justice with robust civic engagement and meaningful partnerships. So local, regional, transit, natural resources, and public land agencies and tribal governments are encouraged to apply with an optional co-applicant, which can include community-based organizations, nonprofit organizations, or social enterprises that fulfill a social or public service mission. So again, it's optional, but then we do want to prioritize like that robust civic engagement component in your project. So usually applying with CBO or whatnot can definitely help in that aspect. So we highly encourage that route. Next slide. So here's the timeline for our SCP Call 4. Again, it's still in development, and this is a rough timeline. We have started drafting the guidelines, and we will do another round of listening sessions in January of 2022. We did the first round in July, and because we have some major changes in the funding opportunities, we had to go back to the drawing board to reconsider the guidelines to fit the new funding opportunities. So that's why we're having a second set of listening sessions early next year, and then finalize the guidelines by February of 2022, so we can go to our board to approve it and release the call by April 2022. And then we will evaluate applications the next few months after that, and we'll award our projects in summer of 2022. Next slide. So what are the next steps? So again, as I mentioned, the second set of listening sessions are anticipated to take place in January of 2022. We welcome everyone to attend, and we will provide more details on the sessions when they become available, which is hopefully very within the next month or so. And we will share, again, we'll share it with this group. So if you're interested, please, we welcome you to join us. We will finalize the guidelines based on feedback from the listening sessions, as well as additional one-on-one outreach that we do with CBOs. And the call is anticipated to release in April of 2022. So I'm happy to answer any questions now if you have any at the moment. I do see a few questions here that Annalie, thank you so much for answering. Yes, the presentations will be provided on the SCAG's website next week, and then our university research center is eligible to be co-applicants for this call for projects. That is something that we have considered, and we don't have a final answer on that yet due to the fact that the funding source that we are looking into hasn't provided all their guidelines. So we don't know yet, but that is definitely on the table to be discussed. So sorry, Eduardo, I robbed you the opportunity of asking your question verbally. So do you have any other questions?
No, I'm good. I see the Sustainable Communities Program. So I'm going to track that and see if, I know there's a lot of exclusions, like who can apply and all that, especially if you have federal funding.
Yes.
And so it's almost like you have to read the CFRs to see who's available to apply, yeah. Right? But your program, is that federally funded, state, or a combination of all?
It will, I believe it's federally funded.
Oh, okay, good. So I can start there. Thanks.
Yes, yes. And we'll release this all the information to this group as well as it becomes available. So you have all the details as well. Katie, would you like to read your question, or I can also?
Yeah, I can offer. So I was just going to say, if there is any, I think one of the questions was how do we start? There have to be resources for you to get started on anything, dedicated resources to building equity capacity. And I have not really found a whole lot of grants that really allow for that capacity building. Most cities are kind of self-funding this, including the city of Long Beach. And so if there is any space for equity capacity building to be a part of this as it relates to long-term planning, I think that that would be very much needed in order for many jurisdictions to get started or build upon what they've already done.
Fantastic. I'll bring that back to the team. Hopefully we can try to work something that into the guidelines, because that is great advice and a great suggestion. Thank you.
I've also
go ahead.
brought this. I know I've also emailed you about this a couple times on like with my like advocacy, but there is no space where Southern California equity people are coming together. Equity offices, other than on our own. I just met this morning with City of LA's Office of Racial Equity, but LA County is starting theirs. We invited Oakland and San Francisco, but as more cities are investing in equity, I think that that would be a really wonderful role for someone to play, like a Southern California Association of Governments. I don't know. Just
well, Katie, I think this might be what we're attempting here right now with you to convene quarterly equity working group folks in the region. And so I'm wondering if maybe folks who are on the line, or Katie, if you do have emails of folks that we should, target and invite to these meetings, that could certainly hopefully help grow the group. So that we can continue to exchange, the information across, jurisdictions. Because at this point, I think I'm experiencing what you're experiencing. It's challenging to find out about the work that's being done across the region, right, and to connect. And so, anything anyone on the line is willing to share with us, we can certainly, reach out to more folks and try to, again, grow the group.
That's great.
This is Eduardo. I raised my hand because I think one model, I'm not advocating that you follow it, but from the Bay Area, there's the MTC, which is the MPO, and there's ABAG, which is the Association of Bay Area Governments. And I think ABAG does more land use planning and larger issues beyond transportation, which is what the MPO does. I think in this region, there's SCAG, but I don't think there's an equivalent of an ABAG here. At least none that I found. If there is, let me know.
We're both, I think, is the answer to that. Yeah, kind of. Yeah.
Oh, SCAG does both functions?
It's MTC is special where it has split its transportation from its land use. So you've got your ABAG with MTC, and we are SCAG. We are one. Yeah.
So actually it's the reverse then, because MTC and ABAG have been trying to merge for efficiencies and all that, but they were created by different statutes. And so I think they're still separate as far as I know.
Yeah. They're trying their best to get along and to partner. Yeah.
Right. Well, historically they've been in the same building, so at least that was progress on that side. So SCAG actually has both transportation funding and land use planning type of responsibilities, which is good then.
That's true, though we're a little different too, because we have more county transportation commissions with different authorities. So it's all complicated, and we could talk offline about how we're a little different from MTC too, but yeah.
Thank you for that. Anna, you have a question?
Hi, yes, I just wanted to offer a quick comment on the idea of bringing together, equity officers from different cities with the Public Health Alliance of Southern California. And we will be convening health departments from the Southern California region as defined by the CCLHO and CHIAC, the County Health Executive Association of California. And so we will be doing sort of a space and a place for health department equity officers and staff to come together and develop and grow their own equity work. So there is some space happening, but I'm definitely, attending these spaces to kind of help make the connections between whatever else may be bubbling up.
Anna, I think I just put the same thing in the chat before I realized you were the Anna from the Public Health Southern California Alliance. So I'm so glad you're here.
Yes, that's me.
Thank you so much for that, Anna, and for Katie for putting that in there. We had such great discussions that I completely just lost track of time, and it is 3 p.m. and we have one more very, very, very short item in our agenda. So if you could bear with me for like 2 minutes. Again, sorry for running over time, but we have a few quick announcements. Jennifer, if you could put up the screen. So I'm going to go through this really, really quickly and talk really fast. So I apologize for that. So the first announcement would be SCAG is in the process of developing or updating our public participation plan, and we would really like your input on how we do our public participation and do our engagement. So if you have some time, please today or tomorrow to fill out a quick survey. It's due tomorrow. It shouldn't take more than 10 minutes, and we'd just love to get your feedback on how SCAG can improve on our public engagement. So there's that. The link is provided in the chat, so thank you very much for that. And then next slide, please. And then we also want to remind everyone that we have free interpretation services for the Equity Working Group, as well as other SCAG events. You can request that when you're RSVPing for any of the SCAG events, as well as this working group meeting. And we just request that you provide it 72 hours in advance so we can properly accommodate your request. Next slide, please. And then we have a few resource items that we provided in the agenda, as well as on this slide. They're all links there. So after the meeting, if you're interested, you can go ahead and read up on some resources that we provided here. Specifically, I do want to point out the Lincoln Institute of Land Policy and Claremont Lincoln University has a series of webinars on confronting structural racism from history to action. It's in late September and in October. There are 3 of them. These are actually pre-recorded, so if you do not have time to listen in live, you will be able to go back and listen in on these webinars, which seemed really, really interesting based on the title and as well as the information that they're providing ahead of time. So lastly, I just wanted to have a few save the dates for you. October 19th, we have an upcoming Toolbox Tuesday, which focuses on equitable engagement. So that might be some interest to a few of you. And then also our next meeting, Equity Working Group meeting, will be December 9. The time is TBD, should be around the same time, but we have not booked the room yet. So we will definitely send out save the day as well as additional information as we get closer to December, which is end of the year. So that's really, really fast. But again, thank you so much, everyone, for joining us for today's Equity Working Group. As we mentioned before, all the presentations will be provided on SCAG's website next week. And then if you have any follow-up questions, we do have all the presenters' contact information in the chat as well as in the presentations. And then if you have any questions for myself or my colleague Courtney, Annalie, Anika, please feel free to reach out to any one of us. And then we really encourage you to reach out, especially if you have a topic, project, program, tool, or any kind of resource that you would like to be highlighted at a future meeting. Again, thank you so much for coming, and we hope that you stay safe and healthy. We'll see you in December, and thank you for staying an additional 4 minutes. Thank you.